Hello, I'm Sharon Hogarth, the Managing Partner responsible for services provided by Maritime Health Partnership. Over the past 12 months, we have concentrated our efforts with patient group engagement to review and consider feedback on access and services. Following this, I have worked closely with your practice team to implement changes aimed to improve patient experience and access. We are proud to have achieved the following service improvements and want you to know the steps we have taken to improve your health journey and ultimately patient satisfaction. So let me tell you about what we've done and what we've been working on. We have engaged a number of dedicated care coordinators able to support personalised care for patients with complex health needs, for example, cancer care, dementia care, and frailty. We have increased the use of personalised care plans to tailor the care to individuals' health needs. We have carefully considered how patients prefer to access services and looked at ways to reduce known frustrations. And as part of the plan, we have introduced a number of initiatives to help you connect with our services. For example, Voice Connect, a repeat prescription ordering service available from your landline 24/7 without the need to call the surgery. Self-booking links, whether it be for a seasonal vaccination or to book a routine appointment, such as a blood test or smear. The self-book link will allow you to choose your day, time, and location of your appointment. To help enable self-care options, we have introduced a facility in each of our waiting rooms to enable you to self-monitor your weight and blood pressure. We are holding regular engagement meetings with our telephone system provider to evaluate and expedite the implementation of a number of new features, including those that can help prioritize patients with complex care needs flagged on our system. Once ready for rollout, this will automatically escalate vulnerable patients to the top of the call queue. We're also looking to implement advanced features which will help you keep track of where you are in the callback queue, should you wish, which means you spend less time waiting to get through to us. Whilst our opening hours have not changed, we now have availability for appointments up until 8 p.m. every weekday evening and also on a Saturday between 9 a.m. and 5 p.m. This helps support our access for working people and working families. Please contact the practice if an out of normal hours appointment would suit you better. We have listened to patient feedback and increased access to same-day appointments and currently treating over a third of all patients who contact us on the same day and continue to improve upon this. We also recognise that many of our patients are busy during the day and therefore offer the option of a remote consultation via telephone or video, for example, during your lunch break or early evening. We deliver a dedicated children's clinic every day from the Pentagon surgery. These appointments are offered over and above the standard clinic rota at each location. This will help minimize anxiety to families with an unwell child. Over 70% of patients are seen within 14 days for a routine appointment. This shows we are making great strides in achieving timely access to good care. We have extended our multidisciplinary staff team, both clinical and admin. We have developed a multi-professional skill mix and workforce around the health needs of the local population we serve in each of our GP surgery locations, whilst recognising the diverse health inequalities across the Medway towns. We have expanded our home visiting team to ensure those patients who are housebound gain timely access to our services. We have developed and rolled out a programme of upskilling for our frontline team in care navigation, ensuring you get the most appropriate healthcare for your needs. We have engaged an independent provider to measure the success of our changes we are making on a real-time basis, giving us a better understanding on how we are doing. We are getting ready to launch this service. Improving patient experience is important to us. This requires continuous review, and we want to work with you to achieve this. If you would like to work with us as a patient partner or join our patient group, please complete the patient participation group sign-up on our website or visit us in the practice. But most importantly, I have one last thing to share with you. And for this, I am going to pass over to our senior partner, Dr. Malik.
Thank you, Sharon. The service, same-day access, makes more appointments available to patients who need to be assessed as soon as possible. What is same-day assessment? As the name suggests, it's a service for people with an illness or condition that needs to be assessed that day, and a suitable management plan will be made. This is what we call acute illness. Something significant enough that we wouldn't want you to wait to be assessed, but not so severe that you should go to A&E or call an ambulance. This includes any deterioration of a long-term condition. We take a multidisciplinary approach to ensure you are seen by the most appropriate, highly skilled professional or service to meet your care need. This could also include a referral to the new Pharmacy First service, primary ophthalmology, or the emergency dental service. So why have we done this? Demand for GP services is at an all-time high. We have listened to feedback, reviewed the GP survey, and launching this new service will mean more people are assessed and managed sooner, whilst reducing the pressure on the wider NHS system, including 111 and A&E. Our staff will work collaboratively to ensure the flexible and responsive same-day access team are available to help patients. So, how does it work? From the patient's point of view, it starts with an e-consult. A simple, online form that captures information about your condition to help us triage your request appropriately to provide the right care, with the right person, at the right time. If you are unable to access or complete an e-consult, you can still contact us directly about your issue, where one of our care navigators will help complete it on your behalf. Once submitted, this will be clinically triaged and assessed by our hub team, who will then make contact with you and advise on next steps. The outcome can include advice, signposting to another appropriate service, and/or an appointment at a suitable location. You have the option to access the surgery in person or reach out to our team by telephone in the usual way. However, if you are able to reserve the telephone lines for those who cannot use alternative services, e-consult or in-person visits, it would be much appreciated. Your health and well-being is important to us, and we recognize the necessity to be able to access healthcare when you need it. We are confident that our same-day assessment hub will help deliver on this. If you like what we do, tell others. If you don't, tell us, and we will endeavor to listen and continue to shape our services to meet the needs of our patients. Thank you for listening and working with us.